So now we are going to discuss about the postmortem findings in case of hanging. So postmortem findings, one is first thing external features. First we'll discuss the external features. So what are the external features? One is face, complete face. So now we are going to see what are the changes we are going to see in the face. So in the head and face, head is inclined to the side opposite to the knot. Now if this is the head, now this is the knot. Now head will incline to this side. This is the knot tied, head will incline to this side, and like if this side it is the knot tied, this head will incline to this side. Okay, now head is inclined opposite to the knot. Now face, because of the congestion and asphyxia, face will become pale and eyes will get protruded. Tardy spots are seen here. Okay, and tongue is also protruded here. Salivary stain, now salivary stain, it is the surest sign of the ante-mortem hanging. So remember this, if you see dribbling of saliva from the angle of mouth, okay, from the angle of mouth, if you see dribbling of saliva, this is the surest sign of ante-mortem hanging. Remember this. And now we are gonna see la facie sympathetica. So what is this is, in hanging, if the knot presses the cervical sympathetic ganglia, which is a part of carotid sheath. Okay, this is the part of carotid sheath. So if the ligature it will press the cervical sympathetic ganglia, the eye on that side remain open with dilated pupil, and other eye it's normally closed with small pupil. Okay, now remember this is a sign of ante-mortem hanging. Okay, la facie sympathetica is a sign of ante-mortem hanging. Okay, remember this. Because of the compression of the cervical sympathetic ganglia, the side where it compression occurs, that side will remain open and it is dilated pupil. Okay, now ligature material, we need to note the ligature material, what color, what type, width, length, position, all we need to note. Okay, and now internal feature, when we come to internal feature, now internal feature, the ligature is tied to the neck, so obviously the tissue under the ligature, it will be dry, white and glistening. It will be dry, white, glistening. Remember this. And because of this, fracture occurs. Mainly it will occur the fracture of the hyoid bone and the thyroid cartilage. If hyoid bone fracture occurs, the fracture is outward in nature. The fracture will occur outward. Okay, and in the thyroid cartilage, if it occurs, mainly the fracture of the anterior posterior horns will occur. Anterior posterior horns of the thyroid cartilage fracture will occur mainly. Remember these two. Okay, now in internal feature, you are gonna see Amusat sign. Okay, this is the important one. Amusat sign, it is seen in complete hanging. Okay, what is this is like, if this is the carotid artery, now if this is the carotid artery, there are multiple transverse tears on the intimal layer of the carotid artery. Okay, intimal layer, you are gonna see multiple transverse tears, and this is seen in only complete hanging. This is known as Amusat sign. Now another one you are gonna see is Simpson sign. Simpson sign, it is also seen in the complete hanging. These two you are gonna see in autopsy procedures. Okay, these two you are gonna see in autopsy procedures. In Simpson sign, in complete hanging, now bleeding or hemorrhages on the anterior aspect of the intervertebral disc. Now this is the spine. Now these are the intervertebral disc, that too beneath the longitudinal ligament. Okay, beneath the longitudinal ligament, you are gonna see bleeding or hemorrhages. This is known as Simpson's sign. Okay, and other signs are like all internal organs are congested. In hanging, all internal organs are congested, and if you see any bowel wall hemorrhages, in the autopsy, if you see any bowel wall hemorrhages, okay, any bowel wall hemorrhages, that is a sign of antemortem hanging. Okay, remember these are all the post-mortem findings that you are gonna see in case of hanging. Thank you for watching. Subscribe.